Good afternoon, everyone. Thank you for joining us for the first part of our new webinar series on housing people who use drugs. My name is Meredith McCarthy. I'm with NASTAD, and I'm joined by my colleague, Billy Golden and Aliko Upadhyay. So we have some exciting stuff coming up in this series, and we're excited to be starting it today. Today's webinar focuses on cultural competence for housing people who use drugs. We have one speaker today, and it is Jessica Martinez from HIPS in Washington, D.C. Jessica will be discussing the importance of cultural humility and awareness when serving unhoused or unstably housed people who use drugs, and how care needs can be complexified by incorporating cultural competence into service delivery. So we'll spend the first half hour or so on Jessica's presentation, and then we'll move into a discussion and Q&A. Billy, do you have anything you want to add?
Sorry. Hey, everybody. I don't really have a lot to add. I just wanted to say thanks for joining us. Feel free to put any questions you have in the chat box, and I'll make a note of that too. Yeah, thank you so much.
Okay, then I'm going to pass it to Jessica to get us started.
Hey everyone, I'm Jessica Martinez. I'll start off with a little bit of myself. So currently I'm a consultant for NASTAD for the Mid-Atlantic region, and I currently work for HIPS remotely. HIPS is a harm reduction program that honestly has a multitude of services. We have washing machines, we have showers, we have a clinic, we feed people daily, we have clothing drives all the time, and we have a clothing rack that we put out that people can look at. We also have housing services. So we have people that do case management for people experiencing homelessness to help them get vouchers and secure housing. We do a bunch of stuff. I mean, we even have tents in our basement just as reserves for people experiencing homelessness, because in our city, one of the shocks that we've experienced as of late during the pandemic has been what the city likes to call cleanups, which cleanups is a code word for displacing homeless people experiencing homelessness, and take their belongings and destroy them and trash them so that way they can vacate and move to another area. So it has been really hard during the pandemic being a service provider and witnessing my clients, Washington, D.C., seeing my clients in Washington, D.C. experiencing homelessness, having their homes bulldozed. At one point, there was a person who was still in his tent, and the city said that the individual that was supposed to check his tent to make sure that no one was in there cleared that tent, and a man was almost bulldozed. So that is, the sort of environment that I've dealt with my clients. And I see some of the comments. Yes, it is horrifying. But I wanted to start off with something nice about cultural competency with homeless individuals. So I will say, as a service provider, always make decisions in the field at your own discretion. Your safety is your own, and you have to set your own boundaries. That's like one of the big things that I will say is you have to know your own boundaries before you start doing this work. With that stated, I will now, say this little story. So we're doing syringe exchange under a bridge, and there's this guy, he's experiencing homelessness. He has this cute little dog, and he tells us, he's like, do you want to come into my home? And I look at my manager, because I was with my manager. So I'm, going to let the person higher up make that decision. And they were like, of course, we'd love to see your home. And I'm like, woo, and this person's home, right? It wasn't what we conceptualize as a home. Like currently I'm in a brick structure with multiple rooms, that's secure against the elements, completely has insulation. That's what we might consider or visualize as a person's home. But this man's home was not like my home. It was much smaller. And he lived in this orange, bright orange, was such a cute color tent. And he brought us in, and he was like, there's my bed, here's my kitchen. And he had like a hot plate and something else that was like a gas powered grill. He also had a bunch of like food stores, and like he's like, here's my bathroom with like my toiletries and stuff. And something amazing that this community actually did beyond just this one individual was they had a toilet that they made and that they upkept and made sure was clean, had toilet paper. So these people actually had a lot of the amenities that we would find in our own homes, right? And these are the homes that the city is deciding to bulldoze. So I want to start off this conversation by saying a home is not a place in a neighborhood. A home is not a place that has a family. A home can be someone's tent, in the city, who's simply trying to survive. And we have to respect that. We have to respect that. I had so much adoration for this man because he was willing to let me into his home. And I saw how much he lit up because I was thinking, like, when I bring someone over, when you might invite someone to your home, you have a little party or something, you feel good to have guests over. You're surrounded by people. And it's that community, that connection that really solidifies your home. And for him, his community, the people around him, us entering his tent and just having snacks with him and talking, that was home to him. So for your clients, when you're working with people who use drugs, make sure that you're like respecting and giving them a space to feel at home, because that's major. That is so major. The people that are going through this experience, and I call it an experience because we must be careful when we label this, right? Like if you say that an individual is homeless, you're kind of attributing homelessness to their life. And they can internalize that. They will internalize that. They will believe, okay, I'm just a homeless person. That's all they hear from people every day is I'm homeless. But when you say it's an experience, this person might have had a home at some point. The people that you're interacting with, providing services to, very well could have had a home at some point. They might not feel comfortable talking about it. Everyone is different. And when you approach the conversation, make sure that you're respecting a person's boundaries. Just as you have your own boundaries that you want respected, respect the person that you're talking to's boundaries. They don't want to talk about what happened. Maybe it was really painful. Maybe it was really traumatic. Maybe it had to do with abuse. You should let that person open up to you when the time is right. And when you have that conversation, if you let that person feel comfortable with you, it can actually be so much more fruitful and can lead to so many better outcomes. So one of the things I also wanted to talk about was the other services that we provide to help people feel at home. So we have washing machines. And the reason that this is so important, right, is because especially in my city, I've noted that people believe that those experiencing homelessness are dirty. And that is simply far from the truth. Individuals experiencing homelessness are always seeking opportunities to access showers, access laundry services. The issue is that most people don't want to give it to them because of the societal view of homeless people. Like I've heard things that people even told me about my work where they're like, oh, but what if they have bed bugs? And, I can tell you from experience that the places that actually have bed bugs are the ones run by the city because they don't care. The shelters are full of bed bugs. So my clients seldom ever have brought bed bugs into our drop-in center. I think in the 3 years I have been working with homeless individuals, it was one time we did one bug bomb and it was no problem. Nobody got bed bugs. Nobody dealt with it. We just put on gloves, make sure that we were cleaning up the area, securing where we had found the insects, and we didn't even know who exactly it was from. So you won't even know, but the point is that in one instance in over like 900 days, to me indicates that what people say is complete ignorant falsehoods that are just angry and negative ideas and stereotypes towards the homeless. So, when you provide these people a space to wash their clothes, they will, of course, be thankful, but it also, can normalize their experience of it. They can come in and access laundry services as they would if they had a home like what we consider a home with a washing unit. The shower is also super critical. When people are exposed to the elements, especially in winter, favor. A hot shower can do so much for them. If you've ever been outside in the cold, now that I'm in Colorado currently, when I go out, the cold is biting. It goes down to your bones. When you're able to access a shower and like just warm yourself up, clean yourself up, remove yourself from the outside elements, it can really be like simply life-changing for some people, and if you are working with those who use drugs, you have to pay attention to this intersection too of possibly experiencing homelessness. I'm not going to say that all my clients that are people who use drugs experience homelessness. The last time that I did a statistical analysis of that, I actually found that more than half of my clients had homes and were using drugs. They had jobs, they had, homes, and that in the more of the minority actually were the clients that I was servicing for my program, specifically methamphetamine, that were experiencing homelessness. Most of the individuals that I engaged with on the streets for our syringe exchange program were with our mobile outreach team. And those people, either were polysubstance users using a multitude of drugs or, using opioids. And sometimes, as I stated, using methamphetamine. About like 40% of my clients were experiencing homelessness. So I think there's this idea too, right? That like drug use, substance use disorder leads to people's homelessness. And I have to state that this is furthest from the truth. There are people that are using drugs, have jobs, have families, have homes. So when you're considering this intersection between individuals experiencing homelessness as well as using drugs, there's an even greater care that must be taken when you're approaching these clients, because you don't want to attribute anything to their experience. Their experience has to do with the systemic barriers. For some of my clients, it's been incarceration. You'd be surprised how many people will not hire felons to this day. That restricts people's economic mobility, their economic viability in this like capitalist system, right, that we exist in, where you have to produce to live. And if someone cannot go into that like rat race of getting a job, holding a place down and growing from there, that's a systemic issue. That's not their fault. So whenever I approach people that, I'm doing harm reduction services for and are also experiencing homelessness, the topic of their use and the topic of their experience as a homeless person are separate, because these two things are not correlated. And sometimes they can be. And if a person states that, that's okay. I mean, if someone like is willing to admit to you, like, this is my experience, then whatever they're telling you is true. And that's okay. Everyone is different. But for me personally, when I approach someone who's experiencing homelessness and is also a person who uses drugs, I never correlate those two things, because they're not. They're not. It's just simply someone's experience. People don't put needles in their arms first. A lot of my clients who use drugs are people who were introduced to something by someone older, or perhaps were introduced to something by accident at a club or a party or a different setting, right? So we have to remember that there's like this, norm in parties and stuff where people may use substances, and some of those people might end up dealing with substance use disorder down the line. I was also one of those people who has experienced drug use and homelessness, and I have to tell you that these two things were not correlated. So and that's from my personal experience. So when it comes to your clients, you got to take care. You know what I mean? They're two separate issues. And what's also important about separating those issues, right, is because when you separate them, like we have housing individuals who do case management, we can have dedicated people that are working on their experience with homelessness who are specialized for that, who know how to work with the city, who know how to get people on the waiting list and help them acquire their housing. And then what we do is we're able to provide the harm reduction services, the syringes, the wound care. And another thing I wanted to mention about showers. Showers are super important to wound care. Infections happen because an area was not cleaned properly. If someone is injecting and then they're able to take a shower because they're experiencing homelessness, you just solve two issues in one by giving them a shower. That's an important aspect of wound care is, making sure that areas where injections are happening are clean. So, like combining harm reduction services for, people who are experiencing homelessness just simply makes sense and has always made sense at my institution, because when you're able to address those two issues separately, people are given the opportunity to grow in those separate respects. I had a client who had been experiencing homelessness for about 3 years. And he himself, during his progress of experiencing homelessness, got on Suboxone. He met with us and he said, I want to get on the Suboxone clinic when he started receiving housing services and case management. Within a couple of years, he was able to reduce his dependence on heroin. It went from seeing him once a week to seeing him every so often, not even to give him works or rigs. It was to give him food and to check on his housing situation. How can we coordinate to work better? And, eventually he got housing. Again, DC is a spectacle in itself, because the apartment that he was put in 2 months later was deemed condemned. So then he was homeless once again. And he still, when we spoke with him, he still said that he had hope, that he had his voucher, he could get housing, and that he was going to work hard to keep, bettering himself. He wanted to be in recovery. Remember, harm reduction is about meeting people where they're at and getting them to where they want to be. So he specifically wanted to quit using drugs. That's what he stated. So, obviously implementing Suboxone, providing rehabilitative services, he's decided that, like, I'm close to, the finish line when it comes to substance use disorder. I'm not going to let this housing situation stop me. I know that you guys can help me. It was really hard not to like cry in that moment, because it's like, we've been working with this person for, like, at that point in the entirety of my career, and he had lost his home once again for a systemic issue, not of his own volition, had nothing to do with him. He chose an apartment complex that took his voucher, and the city decided nobody could live there anymore. And it just so happened that most of the people there were also on vouchers. So, it was really hard not to want to break down in that moment. Strength is another thing that I recommend when, interacting with people in these scenarios, because if you break down, they also will see that as an indicator that things are worse than they maybe appear. And of course, for an individual experiencing homelessness, things can always appear worse. And it's not to say that you're supposed to promise them the world. I also recommend that when you're engaging people who are experiencing homelessness, don't promise them anything. Because if you promise them something and you're not able to deliver it, like if you promise them housing and you're not able to deliver it, that person is no longer going to trust you. So that's another point of the aspect of like care, right? Is that we made no promises to this individual, but he knew that because we worked with him for years, he was able to get a voucher. He was able to reduce his intake of opioids. And on top of that, he knew that with our case management, he would find a home again. So, I have been rambling for 20 minutes. A few things that I just wanted to add before we got into the discussion is, thank you so much all for listening to me. Working in this field for years has been difficult for myself emotionally. I'm sure for you all, it can also be emotional. So what I wanted to end with was that boundaries discussion that I began with. So one of the things that I want to say is that boundaries are super important when you're engaging with people. So make sure that if, like, currently with coronavirus, for example, some people were not comfortable engaging with people less than 6 feet. Me and my coworker, we decided that if someone needed a hug, they needed a hug. And, the way that I viewed it at the beginning of the pandemic was, I work in infectious diseases. I help prevent HIV, and, HIV is a coronavirus. So if I decided that I'm going to be picking up needles and I'm going to be helping people that use drugs, I cannot fear this disease. I cannot fear this virus because I work in health, and it's my job to be stronger for the people that I work with to make sure that they know that it's okay. Of course, we did shoulder bumps and we did, fist bumps and stuff. Hand sanitizer was always cleaning my hands and stuff, always wearing a mask, always making sure people wore masks. But, there were some moments, right, where people just did not understand why they had to wear a mask. They didn't want to wear a mask. And I had to make a decision as a service provider. Do I judge this person for their current ignorance, their not knowing of the situation, or do I love them and I still provide the services? And I know that this was my choice to work this, and that I'm going to still be an effective service provider. Even though I have this fear, and it existed, it was palpable for me. I feared coronavirus. I'm not saying that be reckless. I'm just saying that when you make decisions with your clients, just know that the decisions you're making are things that they're watching, and that matters. The things that you say, the way that you interact with them. When it comes to cultural competency, one thing that I always remember is some people view eye contact actually as discriminatory. If you didn't know that, if some people are afraid and their eyes are constantly moving and you're trying to stare at them, that actually can put someone off. So something as simple as staring at them, can be off-putting. So, always understand that when you're approaching these people, that you need to take care in the decisions that you're making, and that their experiences are separate and not a result of who they are or their choices at all. As a service provider, I'm going to keep hugging people. I'm going to keep, being a shoulder to cry on. I always think it's funny whenever my shirts get crusty from mucus and like tears and stuff, because then, I'm there like, ooh, but I know that, I probably really helped out somebody, even though my shirt's all crusty. So I just wanted to end with that, you are a light in this person's life. Be that light, shine brightly for them, and help them shine too, because that's really what matters when you're engaging this population.
Oh, thank you, Jessica. That was a really lovely last sentence there. We've got time for some Q&A. And really quickly, because we can unmute and have people talk, but we did get a question a while back, and I just wanted to make sure we addressed it. It was a terminology question, and it says, is it better to say homeless or unhoused? It says, obviously, I'd take it case by case. Everyone's preferences are different, but I'm not sure of the subtle differences between the two terms.
Okay, this is a really, really awesome question. I love this question. Okay, so I have found that unhoused, if you have sometimes for me, even homeless slips out by accident, right? Like we're raised, with this word, right? Homeless, and it's really hard to break apart. So I have found that homeless in my line of work sounds worse to people than unhoused, because unhoused kind of leans into that experiencing homelessness, right? Because experiencing homelessness is a little bit of a mouthful. Some people can still take offense to unhoused. Of course, I'm not telling you that unhoused is the good word. I'm just saying that in comparison, I have found that unhoused kind of works like undocumented. Instead of saying I'm Hispanic, whenever I hear illegal alien, I'm like, but when someone says undocumented, it's like, okay, this person is here, but they lack documents. So homeless, right, is this person lost their house, they are homeless. But unhoused is more like this person currently does not have a home, kind of like undocumented. This person currently does not have documents. If that makes sense. Of course, people's preferences are different. So I do want to also say that if someone describes themselves as homeless and they keep describing themselves as homeless, that is an indicator, like kind of like, you know, of course, take with care, but that's an indicator to me as a service provider that that is how they describe themselves and they're okay with that word, and that word is not negatively impacting their mental health. I think the key part here is the individual that you are providing services to, mental health. And one of the hard things about masks is that you're not able to read people's faces as well. So you know what you got to read? Eyes. Okay. If I'm happy, my eyebrows will raise. If I'm mad, my eyebrows will go down. So just that is a really good indicator. If someone's eyebrows are raised, they're like, oh, but if someone's eyebrows are down, they might be like being like, what did you just say to me? So that's been my new cultural indicator, like, you know, face recognition indicator of like, how is someone feeling about this word? Like I said, if someone uses homeless in my institution, like we find it acceptable to use the terminology that people use. For example, as someone who struggled with substance use disorder, which is the right way to say it, I used to call myself a tweaker, and I know clients who would call themselves as tweakers, and they love the word tweaker, you know, because it just specifically means someone who's using meth and getting amped up. So when it comes to cultural competency, there's always this care, right, about what we initially say. So that's where I say experiencing homelessness. Like if you were walking into someone, you could be like, we provide services to those experiencing homelessness. And then they're like, oh, well, I'm a homeless person. I've been homeless for years. Maybe the word homeless is okay for that person. But like I said, unhoused to me is kind of like undocumented. It's like this person currently in their situation lacks a home. They are unhoused. So I know some service providers use unhoused versus experiencing homelessness because it's slightly, you know, less syllables. But like I said, it's at your discretion, and always listen to the people that you're talking to because they're going to indicate to you what is okay.
Hey, Jessica. Oh, Billy, do you have a question?
No. Just there was a follow-up note on in relation to what you're saying, Jessica, that was about what you thought about using the term vulnerable population. So I was just...
Vulnerable population. I mean, I understand why people use it. To me, it kind of errs on the side of kind of like, you know, like when people say developing nations, like it's kind of implying that old world, like when people used to say third world countries. So like I can see like when you say vulnerable, like vulnerable to what? Like the elements? Okay, that's true. But to me, like vulnerable population kind of makes people experiencing homelessness sound weak in my mind. I like to inspire strength. Like our name for our organization to honoring individual power and strength. So that's what I'm going to always try to do for my clients, is inspire and strengthen them. So in a discussion with like the government, they're probably going to use the word vulnerable population because that's when I usually hear it, not from like NASTAD. I mean like DC, like, you know, government. Let me be clear. So, you know, I've heard that discussion before. I have to be honest with you, as a service provider, I have never labeled my clients as a vulnerable population. I just label them as my clients. And the reason I like the word client is because it's a little bit discreet. Like when you are a business owner, right? Or like a bank, you have clients, right? So I like the word client because to me, it makes it sound like the person's coming to me for a service and receiving that service. I've never really called any of my clients like vulnerable, but if anyone else or like Laura has something to say.
I always have a thing to say. I don't know. No, Jess, thank you so much for that. And Jasmine put it in the chat too, because you know, the idea about vulnerable populations as a term, yes, it will, like when you submit that federal application, it will like flag that yes, you're talking about who they want you to talk about, right? So there's like Fed speak and grant speak, cool. But, you know, it takes the onus, it puts the onus of a sense of that person being vulnerable of their own accord. It takes the onus off of the system, right? And so often when speaking about being made vulnerable, being made marginalized, we're really talking about systems that are setting people up to be vulnerable, right? That are increasing inequalities and vulnerabilities, right? And so, it's wordy, but it is true. These are the systems that are designed, like you said, to not support each other or to support people, right? I'm wondering, I mean, my big question, right, is like, how can systems, either public health systems, social services, be better? And it came to mind to me in some ways here, right? Like I live in New Orleans. Oh, and for those of you, I'm Laura Pegram. I'm the director of Drug User Health here at NASTAD. I live here in New Orleans. And in New Orleans, there are a lot of people who choose to live outside because the systems are so not set up for their life. And I can think of lots of examples of this. People have animals for protection. People use a lot of stimulants down here, and there are curfews. People, all kinds of barriers, right? There are not family unit shelters. There are not. I guess I'm curious because this feels like a call with a lot of folks who are direct service providers or work for those agencies or work for the systems that should support those agencies. How would you or anyone really, oh yes, Morgan's like, it's bad, it's really bad. How would folks advise about how to assess why it is that in many places people don't want to go into either shelter or like family housing situations?
I just like off the top of my head, quick answer, surveys. And one thing that we started doing was we did surveys with gift cards, and we would send our team out, and we have like regulars, right? We have people who are, like living outside, like Laura said, which is another great word, living outside. People choose to live outside. Yes. Like, thank you. And, we give to some of our clients that we know, we just be like, hey, like, here's a questionnaire. If you want to fill it out, you get this gift card that gets you food. Some people view providing monetary compensation for surveys like that, or incentives as a negative thing, because then people will be incentivized to answer your survey in a certain way. I just want to dispel that really quick, because that energy to me feels very like highbrow academia. Every single time I've seen it, it's like people blaming the population they are trying to serve. So, I just want to be clear that financial incentives might help your clients and might actually be great for people living outside. So I just want to throw that out there. But we did surveys, and one of the interesting things that I found specifically for the DC case was that there were a lot of individuals who lived outside because they served in the military, and the Department of Veterans Affairs was not providing them the services that they needed health-wise or mental health-wise. And they felt that it was easier to live outside. So that was actually one thing that I found out, which if someone in DC government calls them a vulnerable population, how are they vulnerable? They made that choice, So I feel like, when we interact with government, we try to always like remind them of these situations, remind them that like when you are displacing and moving people from parks and you're telling them that you're going to house them, you might actually be impeding on their own individuality and their own power, which is violent in my mind. It's completely violent to take away someone's autonomy. So, I would say that if you want to collect data, like get a litmus test for the area you're in, surveys, incentives help. And, just like asking people, and like someone said, don't ask why. I think that's very important to bring up in the chat, because that is going back to where I was saying people will open up to you. Do not make people open up for you. That's important when trying to also find this out. Don't make people open up for you. Have people open up to you. And that takes time.
Yeah, just really quickly, I mean, you just reminded me of a phrase that was popping in my head as in your earlier presentation of, it's the same with drug use, right? Like start from a place of what's working, like something is working here, right? Like something is working. This person has found a way to make a toilet in a tent, and this, like, that is would challenge lots of you to try and do that and live outdoors in this way comfortably. And yeah, starting from that, what's working here? Because people are clever. They make things work.
Sorry, the chat's very lively, so I've been going back and forth. Open up
Another question.
For any other questions?
I have another question for anyone in this call, because I do see a lot of familiar names, and I love that. I like want to say hi to everyone, but my fingers don't work that well to type that fast. But I see a lot of folks here who live not in urban centers. And I'm wondering, either Jessica, Billy, you live not in an urban center, if folks on the call can speak to or talk through some of the key differences, because there's some pretty huge differences in how houselessness can look in urban areas and densely populated areas that have a concentration of services, quite often, even if they're really crappy services. And housing instability in rural areas looks like a whole different kind of thing. And I grew up in a very rural area. So, just curious if, Jess, maybe start with you, and then others, if you want to chime in, I would love to suss into that a little bit more.
I was just gonna quickly write in the chat, but I guess I can just say this for about toilets and sanitation. So something that I mentioned before we started this call was we have pump sinks, and they're really cool. So in like rural areas, right, like you might not have access to like running water, but you can have a water tank. And if you have access to filtered clear water on a campground, you actually can fill up a water tank, and there are pump showers, pump sinks. And if you lack access to a bathroom, a composting toilet only requires you to put an amount of compost, and then there's a latch actually that you can pull back. And once the excrement enters the space, you till it, and it actually does not smell that much at all, because the compost breaks down the feces, and it actually provides a sanitary, like easy, no running water needed way of using the bathroom. So if people are lacking sanitation services and are in like rural areas or even urban areas where you're not able to access like buildings or like running water, tanks and pump showers and sinks and composting toilets, that is what people actually use when they live in camper vans and stuff. And for some of the people here in Colorado, I've noticed that the experience of homelessness is a little bit, different. Like there are people in the like urban centers like Boulder and Denver that live in like tents and, live outside in their own tents. But some people experiencing homelessness actually live outside of their vehicles and have converted their vehicles to have amenities like cookingware and sinks and other things, which I think is like awesome, because I saw this phenomena as like a millennial, like young hip person thing where they were like trying to, van life, #van life, if you want to look that up. But then people actually took that and used it for their situation. So I thought that was creative and amazing. And that's something I've noted in Colorado. People are so cool, man. Like their car homes, I love them. They're awesome.
So hi, Jessica. My name is Stephanie Covington. And I'm a veteran. I also work for the Department of Veterans Affairs, so I'm sorry, I'm part of the government. But that's not my scenario here. It is my scenario in Seattle, Washington, when I visited my daughter. So here, people are not being creative. They're not fine. Well, some of them are, but for the most part, it's in very bad situations that veterans may want to stay in. And I think the social workers that I work with will bring them things. At one point, one of the veterans had the mall give them a tent, give them a generator, give them everything they needed to stay outside, to keep their tent area warm. But we don't have a lot of tenting communities. So the most part, I think here is about safety. And I also wanted to reference more on this word vulnerable that I use quite often. For my veterans who are housed, and are abusing substances. And I find I'm in distress most days than not, trying to help them like gain a better life without the use, even though they want to, or they choose to continue using. So I get very emotional, one, because I'm a veteran, two, I work for the government, and this is certain things we have to do or follow or say, or I can't do certain things. So one, I'm glad I'm on the call. Two, I get a little like, my vision and your vision are two different things. I don't see this thing you're saying. If that's okay.
That's okay. I am actually really happy that you're here too. I just wanted to say that, like, you know, like I said, in my experience with government, when I've like, you know, my governance is a government that would rather spend money on palm cards and where to find Narcan when we already have a center that provides so much Narcan to the community, and paying actors for ads where, you know, it's like paid actor. Hi, my name's Sam. I used to be addicted to methamphetamine, which is so similar to the Reagan era war on drugs. So, you know, when I hear vulnerable populations from those people, like it's, you know, they're making decisions that they view these people as vulnerable. So they need to get information to them about how they're like vulnerable and how they can become less vulnerable. Like that isn't providing services. And I'm sure, like in my mind, because you brought up what you brought up and you're saying what you're saying, that's not what your case when you use that term. And I hear that. And I want you to know that it's, you know, like I don't like it because I've heard it used in a way where it's like almost like a savior kind of thing, but you don't seem like a savior. You're part of the people you serve. And that's great. So
yes, I'm part of the people. I was a homeless veteran. I was addicted to drugs. I was labeled this thing. So right now I sit on this table where I'm trying to express maybe what you're saying in a form of non-listeners. So it can be difficult at times, and I have to follow these because then they gave me a job. So I'm the voice of the veteran, even though I have to work on this clinical team. So trying to get these things across in a way that it can be communicated and change can be made. But sometimes I feel I sit alone, not from you all, but just at that table.
It like takes a lot of time. And I mean, like, I feel you. Like there have been so many times where I have said something and then I feel like, you know, a year or two later, the government's like, so we're going to start crisis prevention teams because we came up with this great idea of having a harm reductionist, a social worker, and a violence interrupter, which violence interrupters in my city are people that were formerly incarcerated who work with individuals who might be engaging in something that could be considered aggressive or violent. So the police are not called. So that way they are not killed by a police officer. I don't think I need to explain that aspect. If I do, I will, but you know, the whole cops killing people. So we pitched that idea like years ago and we were like, hey, like, you know, maybe we would reduce deaths by police if we like had teams that were like mental health teams to deal with like mental health crises. And they were like, and then years later, so we're going to start doing this. And here's
exactly.
So like, I feel you. And I just want to let you know that be ready for people to take your ideas and make them seem like they're your own. And that goes for
anyone. Done that. Yes. I'm so glad you said that. I feel so much better now that I'm not alone. And I don't want to disrupt this whole presentation, but one, I want to thank you for your response. And two, I guess this is how it goes. It's like, but we got to do better.
That's real. I super appreciate this. And Stephanie, thank you for joining. And by no means do I'm, you know, NASTAD, we represent public health all across the country, public health, state, HIV, hepatitis, drug user health programs. And we also work with community-based groups really very closely. And I think of it as a vitally important bridge, right? Because while we can really acknowledge that you know, DC can probably do more, and they can probably take away the police budget and just buy housing and, you know, afford housing. But like that might be not tomorrow, you know, and we need people working within government who get it.
Yeah.
We need more of you at the table. We need more. And that is a stacking of the deck that I feel like is just often really missing. And also, you know, we need to learn from systems like the VA, like the Ryan White systems, the HOPWA systems, because y'all do more wraparound care and connected care services than every other, you know, broken, fragmented, siloed systems that really struggle to talk together. The idea that like harm reduction and HIV prevention for people who use drugs is often so detached from behavioral health. The idea that SAMHSA and the CDC are just now recently coming together and joining forces to create more comprehensive care services for people who use drugs, like, so there's a lot of work here. And so I appreciate you bringing that up and highlighting that.
And if they didn't know already, it's always been harm reduction. Drug addicts just found a way to continue to use it until they could finally quit. So it's always been harm reduction. It's not new.
Yeah, yeah. Something's working about that drug use.
Yeah. Thank you.
Yeah, so I kind of wanted to add to the discussion a little bit. So my name is Josiah Harrison-Benjamin. Right now I live in Indianapolis, but I also do this work in Maine. So I kind of have two perspectives. I have the urban perspective and I have the rural perspective. And what I can say about the rural, the differences between the urban and the rural perspective is that I feel people in the rural areas were definitely more like, you know, they noticed their environment and they were just more, they more adapted to the environment. Even though there were less resources, even though like it was harder to get to those resources, even if they were available, people were very, you know, they were very, you know, connected to their environment, and they, you know, were very resourceful. So like that was one of the great things I miss about Maine, is that the resourcefulness of the people, and like what they could like, and what I've learned from, you know, other than today with the whole toilet discussion, like that's pretty amazing. I didn't know about that. So that's one thing I learned today. But like just like how like people can take an environment that is unpopulated and undeveloped and turn it into their own. And like it's just amazing, like some of the things I saw out there in Maine. And here in Indianapolis, like even though there's more resources available and, you know, it's easier to get around, there's public transportation and everything like that, you don't really see a lot of that.
I can speak on the lack of public transportation because I was born in Miami and we have one metro line. So getting people services in Miami is even more difficult because it's an extremely car-centric city. So I understand that. Actually, one of my colleagues is currently in Birmingham, and Birmingham has this odd public transit system where all the buses go into the city, and then from there you can catch your bus to where you actually need to go, which doesn't make a lot of sense for people that are living out in a certain area, you know, like who might not have the economic viability of living in the center city, who might very well need access to that public transportation. So public transit is another thing that is very lacking in our country. And if we just had like a little bit more infrastructure towards public transportation, we would be able to actually get people to access services a lot easier.
I mean, like one of the places that I can remember in Maine that needs a lot of work is Washington County, Maine. It's very rural. It's in the northern part of Maine, borders Canada. And like Washington County is very poor. A lot of drug use, a lot of housing instability. There's a lot of, you know, not really good things going on there. And the lack of resources, because a lot of the towns are near bankruptcy, so they can't provide, you know, the services that, you know, the people need to get on their feet because of, you know, they just don't have the money. The towns are failing, and it was just so heartbreaking to see like all of that in Maine, and just like people just put aside and just I don't know. It was such a sad sight to see that, and like that's like places like that And I have friends who live in places like Mississippi and Louisiana who have the same problems too. So it's just like some attention to some of the rural areas need to be, definitely like, part of the discussion as well.
We have 2 hands raised. I'm going to go with Morgan first. Morgan, if you could just come off of mute and ask your question.
Yeah, so hi, I'm Morgan. I'm in Huntsville, Alabama. I provide services to a city-sanctioned encampment here that probably has about 150 people in it. We just kind of expanded recently from 70-ish people back up to 150. There's no running water. And when I say city sanctioned, I mean, they just let these people put their tents there. There's no services provided. So without running water, there's a constant concern for infectious disease. Hep A is really bad. Hep C is also really bad. Really pretty much everything you can think of. Excuse me. And I guess my thing is, we've got services that are being provided. Everybody's throwing food and clothing and those kinds of things at my folks down there, but what they don't have access to is like an organized and accessible system at all. You have one way to get into service. You have one way to access healthcare, sort of. And if you can't, won't, or don't participate in those ways, there's no other way to get into care. And because this is Alabama, it's about as backwards as you can imagine. You gotta be 12-steppy. You've got to be kind of Christian. You've got to be straight and preferably, no darker than lily white. And it's highly frustrating because, here I am, I'm this little like grubby punk rocker, like harm reduction kid trying to bridge these gaps for so many people. And I mean, there's a lot of resistance just to me, never mind the folks that I'm trying to sort of help feed into these systems. And I'm curious if you or folks you've worked with have insight into sort of working around some of these more resistant, I don't know, structures and cultures, because really yeah, I could strangle people daily. And I mean, some of them are like my participants. It's not, they're not always making my job the easiest. So I don't know, just thoughts in general would be great.
So one thing that I've learned over the years is patience. I, as a Hispanic trans woman, have been told some very colorful things by my clients before, and I have to make a split-second decision. Okay, I'm just gonna let that, So dealing with difficult clients is difficult. My huge advice is just patience. There has been people that have told me to completely fuck off, excuse my French. And then a couple weeks later, they see me interacting with other folk and they're like, okay, maybe she isn't a cop, and that's okay. When I think of a client that is giving me difficulty, I start to imagine some of the reasons why they're being difficult. And I'm not saying that's not what you're doing, but it's just I always have to check myself, maybe someone might have peed in my Cheerios today, but what is peeing in their Cheerios every day? And that kind of helps me soften some of those blows that they might throw at me, because then I'm like, okay, well, maybe they're just unhappy and they called me the T word because it made them feel a little better. And, maybe that's not right. That doesn't make me feel good, but I know that they're coming from a place that might hold anger, and that's okay. That is something that can be worked on little by little with a whole lot of love. One of the things I wanted to say is if you have a lot of people throwing food and clothes at this place, I want to like ask, have you asked them if they know what to give your folks? Because one of the things that we noticed was there was all these people trying to throw clothes and like food at the homeless. Or I'm sorry, I just said homeless, people experiencing homelessness. See, I mess up too, so don't worry, all mess ups are okay. Just always checking yourself is important. For people experiencing homelessness, they didn't know what they needed. So like, for example, those hand pump sinks and the hand pump shower, if I recall correctly, was donated by a church. And it was because they had money that they wanted to donate, and they were like, we don't know what to do. Like, we were going to buy food and clothes, which is like what everyone thinks, right? Oh, unhoused individuals, people experiencing homelessness, throw food and clothes at them. But if they don't know where to direct those funds or like what specifically to fundraise for, you know, people aren't going to know if they've never experienced homelessness. So I think one of the important things that I do with other community leaders is I tell them, this is an issue that these people are experiencing. They are lacking sanitation, like they need water. Boom, like, you know, people will do a drive for like water, and it might not be that easy, but sometimes I like to remind myself that if you haven't experienced homelessness, it's going to be hard to think about. Like when I first started experiencing homelessness, I never knew that like accessing a shower, using the bathroom, like was going to be hard. I didn't know that drugs were free on the streets. You know, I didn't know that drugs were going to be even easier to get on the streets for me, you know, so there are things that I didn't even know before I experienced homelessness. So, you know, people sometimes are just unaware and just want to do something to help people. Something like I noticed was there was a lot of fires that left people without homes here in Colorado, and you know, people were throwing clothing and like food at them, and at some point they were like, we don't need this, we need heaters, we have no heat in our house, we don't have electricity, we need generators. And then the community was like, oh my God, we're wasting all this money on other stuff. Now people are getting generators, space heaters in their home. There are even plumbers that are saying, if you lost your home in the fire, I will come and do your plumbing for you for free, so your pipes don't freeze and you have to pay more, you know. So yeah, you know, like, and less judgment from the cops is hard, because that actually means like working with the police, as I've learned over the years, and that can be difficult, and those conversations sometimes might be super painful. But you know, we're at a point now where I see more police officers narcanning my clients on the streets instead of arresting them, and that's that to me means the world. You know, after 3 years of just what I felt like was like police state tyranny has shifted into, you know, care and worry for the people that they serve, you know, like that whole idea of like protect and serve. I'm not trying to say cops are great, but I'm just saying that if you give them a chance, they can change.
Well, I really acknowledge that we're very much out of time, but I do just want to say to Morgan, to everyone on this call, and Meredith and Billy, you'll wrap all this up, but this work is really hard. Whether you work in the system, outside of the system, as a part, I mean, like, this work is really hard. And so, you know, Jessica had said it, but finding the ways to, you know, kind of not protect yourself, to protect your energy, to keep it there, is huge. And everyone, that's going to be different for everyone, obviously, but like staying engaged, being tenacious, fighting for your people, fighting the systems that are fighting your people, hugely important. And yeah, I always appreciate folks. So please find good ways to take care and take care of each other. So Meredith, Billy, thank you for this session. I appreciate it.
Thank you guys for all joining us. And thank you, Jessica, for being amazing. Great speaker. The next webinar is going to be on Wednesday, February 2nd. We'll be sending out more details about that on the listserv. So until then, I guess, thank you for joining us and hope to see you again.
Thank you.
Thanks so much, everybody.